So Carl, talk a little bit about how Aplos has kind of come together and what you're doing in that space.
Yeah, and for the three of us, our core focus of Aplos and working and building this with BJ was really aligning it, since we were going to be part of it as Exemplar Care, Hy-Vee Health Exemplar Care, that it really matched our values. And so, one, we wanted to solve healthcare challenges, and we saw a challenge both with costs of health plans increasing, also the inability of whether it's the person helping the company to put together their health plan or just the company themselves, an HR leader, a CFO, a CEO, understanding how they could put DPC into their benefit product. So we saw it as an opportunity to embed ourselves in a plan and ultimately be able to not only grow our business, but to solve those challenges, offer the care we wanted. So we did. We went in really focused on how do we provide a transparent opportunity in a self-funded health plan or a level-funded health plan structure. And we started to build kind of what I've always talked about. The easiest way to explain to people, especially not in healthcare, is really it's like a bookshelf, and you're adding the various books of the library that you want and you feel like are going to make you better, more well-rounded as an individual. And so we did the same thing from a health plan, from the right TPAs to certainly we felt like us as that DPC quarterback, to a transparent PBM with Vivid Clear, and you start getting into just more and more of the tools within that, and how do we bundle that together, because healthcare is complex, and we didn't want to create a health plan that looked and felt more complex for individuals when they go out and show their card, or they have to hear from their employer about their new health plan. And so we work to brand that way.
And for folks who've done this in the past, folks listening in might have wondered how smoothly does this go? What's the transition for HR? And I think at this point, recording this, we've got some experience. And what have we done? What have we really been working on this year that's eliminated almost all the noise and disruption you would
have? I mean, that was something that, again, first year we learned from it, and so always improving, and we heard the feedback of that noise, and collectively we sat down as a leadership team and said, how do we make this better? And we felt like having a single point of contact for our members, for the health plan members, that also tied to us, really made a lot of sense. And so we built out what we call our one call team, and it really is just that. It's one place to call that is that conduit for our members to make sure they're getting all their questions answered. They're not getting handed off to 2 or 3 people. They're not having to re-explain themselves. I always take it back to, Nate's examples in the past of having to come in and always explain, your same allergy that you've had for 25 years. I don't want to talk to 4 different people on the phone about the same thing that I've just had to explain about either a visit I had, a bill I had, an EOB I don't understand. I want to talk to one person, have them solve that for me, and give me the feedback either in real time or with a real person calling back. And so that's something we really built off of what we had created at Hy-Vee Health Exemplar Care and moved it into that plan structure. And it's just been something that's very important to us in how we deliver to our patients.
Just back to our solving healthcare challenges, Jackie Robson and team have done a tremendous job of making sure that that's something that most people don't have.
Yep. And
it's something that we needed, and to be able to even refer to the places we want to and get people the care that they want has been I think
it's been a game changer.
I think it fits our core exactly
Yep.
to what we're trying to do, and solving the things that most people wouldn't want to do, and we did it. So
yeah, it's the hard work.
Credit to the team.
Yeah, absolutely.
From